In this video, we'll talk about the Crohn's disease, which is an inflammatory bowel disease characterized by chronic inflammation in any part of the intestine. Unlike ulcerative colitis, Crohn's disease occurs in any part of the small intestine and not restricted to the colon. Clinical features of Crohn's disease include diarrhea, abdominal pain, weight loss, reduced appetite, mouth sores, blood in the stool, and few others. The risk factors include smoking, stress, NSAID overusage, age is a risk factor in general for IBD, race, generally the white people are more at risk for IBD than the other races. Family history is important because there is a strong genetic component of Crohn's disease. And dietary fiber is another factor that governs the risk of Crohn's disease. So the gut microbiota is another important factor which dictates the pathology of Crohn's disease. Generally, it has been found that the firmicutes and the bacteroidetes are actually reduced in number in case of Crohn's disease, whereas the enterobacterial number has increased dramatically. Other than that, adherent invasive E. coli and other kind of pathogenic bacteria increases in case of Crohn's disease. So the overall pathology is due to a tilt in the balance of inflammation. Generally, the pro-inflammatory cytokines and anti-inflammatory cytokines are balanced in the intestinal situation. And this balance is modulated by cell types like regulatory T cells, Th1 and Th17. In case of Crohn's disease, Th17, Th1, these kind of pro-inflammatory T cell subtypes increases in number, whereas T regulatory cell decreases. So overall, there is an excess of pro-inflammatory cytokine and reduction in anti-inflammatory cytokine. That leads to the problem. So it has been shown that the expression of STAT3, interleukin 17, also increases in colon tissues. Th17 is one of the key regulator and modulator in this particular disease pathology. IL-17 is a pro-inflammatory cytokine which is thought to be important for Crohn's disease pathology. Other than that, antigen presenting cells and other immune cells infiltrate the overall intestinal tissues. When there is a bacterial invasion, there is inflammation in the local intestinal lumen, and the bacteria can get in but detected by several antigen presenting cells present in the intestine. Now these antigen presenting cells would eventually secrete inflammatory cytokine, and that would modulate the differentiation of Th0 type T cells into Th1, Th2 or Th17 subtype. All of these subtypes have their individual cytokines that they secrete, and all of these cytokine actually helps to increase the inflammation. So overall, we understand that inflammatory increase is one of the key factors involved in the Crohn's disease. Crohn's disease is not an autoimmune disease, it's an immune associated disease. Now Th cell can be differentiated into several lineages, Th1, Th2, then there is Th17 and T follicular and many others actually. But in case of Crohn's disease, recent research has shown Th17 to be very important. Anyway, Th17 T cells are pro-inflammatory and they play important role in antifungal immunity. Th17 cells are dominant infiltratory cells in case of Crohn's disease, and they secrete cytokines like interleukin 22, interleukin 21 and interleukin 17, which all lead to massive inflammation of the intestine, and that has effect on lungs and the overall gut health. So let's talk about some histological features. So if we cut a cross section of the intestine, we can see the tissues like this: mucosa, submucosa and muscularis. Now in case of Crohn's disease, where inflammation has increased, one can see increased amount of immune cells clumped together and forming a granuloma. Here you can see in the histological image there is a granuloma formation, and this is basically many dead immune cells along with the pathogenic bacterium together. Now when it comes to genetics, two important risk factors are associated. One is a mutation and polymorphism in the gene which encodes for pattern recognition receptor NOD2, and the overall components of the nuclear NF-kappa beta signaling pathway. So kind of like defect in any of these aspects can lead to or can increase the risk of the Crohn's disease. Now, Crohn's disease overall symptom can also be extraintestinal. So there are many extraintestinal manifestations in this disease. Like there are problems with hepatobiliary system. There could be cirrhosis, there could be colorectal cancers, small bowel cancers. There could be respiratory complications like obstructive sleep apnea, chest infection. There could be problem in vascular system leading to portal hypertension. Then embolism is another problem. There could be bone related issues in this disease, but these are all secondary and doesn't occur in all the patients. So the overall disease is quite variable. Let's talk about some diagnosis. So endoscopic imaging is one of the gold standard, but anyway, from the biopsy sample, if histological analysis is done, then granuloma formation could be strikingly visible in these Crohn's disease patients. And now there are different laboratory biomarkers. Presence of specific C-reactive protein, which generally increases with inflammation, which is an indirect readout. Anyway, so there are other proteins like calprotectin. If those proteins are highly found in the fecal extracts, then it could be an indicator of Crohn's disease. But none of these biomarkers are very specific to this particular disease. Novel biomarkers are required to understand this disease and diagnose this disease in a non-invasive fashion. Question is when to see a doctor. So if you see persistent change in your bowel habits and you have pain in the stomach, or let's say whenever you eat you feel some kind of like inflammatory sensation, then it's time to visit the doctor. But what are the treatment options? Generally, this particular disease is treated with some amount of antibiotics because the bacteria are the key starting point for inflammation. Now, once it cannot be controlled with antibiotics, then the immune response can be suppressed by steroids and thiopurine. Later on, more specifically, anti-TNF or cytokine therapy can also be done to reduce the overall inflammatory manifestations. And the ultimate thing is to remove those portion which is highly inflamed using surgery. But surgery doesn't cure the disease because many portions of the gut can be or in the intestine can be affected in case of Crohn's disease. So which part should be removed? Other parts are equally susceptible for this disease manifestation. So this disease doesn't have an absolute treatment, but it can be managed at several different levels. So I hope this was useful. Get notes and flashcards in Facebook page and Instagram page. You can support our channel using super thanks. You can pay via Paytm, PayPal or UPI. See you in next video.